Hello again, I'm Dr. Lisa Sullivan. I want to welcome you to my practice. We look forward to seeing you at the consult coming up. I did want to reiterate just a couple things before you come in on what we talked about at the seminar so that you have a better idea on the approach that we use and what to expect. The typical approach that the majority of physicians in America practice is designed to address acute care. They are trained in treating crisis problems such as trauma or infections, whether it's pancreatitis or a gallbladder that needs to be removed or a bacterial infection. The tools that they are used to using, such as surgery or drugs, are typically used to address the immediate short duration of that problem. Unfortunately, the training, the application of the type of tools needed to address chronic degenerative problems that most Americans are suffering from lack actual resolve, and this is why these problems are out of control in this country. In functional medicine, we're going to be using an approach that actually looks at the underlying cause that led to these problems. Whether it's diabetes, autoimmune disorders, or low sex drive, we have to look underneath this using science, using the proper labs, and focus on using these as a map and not simply trying to change these labs with medications, but alter normal physiology and bring that function up. We have to look at each individual, including yourself, and find out everything that could have brought this problem about, such as environmental factors, genetics, lifestyle factors. These all play a role. So we'll look at you uniquely to understand this, and we'll use natural tools such as diet, cleansing of the body, and very safe botanicals, things like this that actually make these changes occur over time. One of the things that I'll ask you to do is to bring any blood work or labs that you have. Please either fax them or bring them with you when you come into the appointment. We can call and request them from your doctor with your authorization if you need. However, I will be running the proper labs needed so we don't miss anything. No guessing games here. The other thing I'm going to ask you is to please bring your spouse if you're married. The reason I ask this is because if I do become your partner, your mentor in health, I'm going to be asking you to make some lifestyle changes. Having an understanding of your condition is important for you and your spouse. We will be spending a full hour together, and I found that it's literally impossible for you to take all that information back to your spouse and educate that person if they aren't here. I respect this person as your partner, and I think it's important for us to meet. So please make sure that the time works out so that that can happen. With that being said, I look forward to seeing you, and I hope I can be your partner in your health and your lifestyle.